The discourse surrounding penile size is invariably imbued with an aura of mystery, frustration, and frequently disillusionment, often stemming from distorted societal benchmarks and unrealistic expectations. At some juncture, the vast majority of men have undoubtedly grappled with queries such as, "Is my size within the normal range?" Or, "Are there efficacious measures I can undertake to augment it?" Yet, instead of chasing after panaceas or miraculous cures, which, it must be noted, prove uniformly ineffectual, it is imperative to recognize that certain lifestyle adjustments can, quite organically and without risk, not only enhance one's perception of size, but also bolster the overall functionality and physiological well-being of the body. Samira Poas, a therapist specializing in male intimate health, serves men of all ages, from younger individuals seeking self-awareness to middle-aged gentlemen striving to regain lost confidence. She reveals that penile size is not static. Indeed, it can appear larger or smaller depending on various physical and behavioral factors. But first and foremost, one must dismantle the notion that a miracle formula exists. Hence, today we delve into 5 practices you can adopt starting now, with safety, awareness, and most importantly, with genuine and sustainable results. No misleading assurances. Here, the discourse is serious, evidence-based, and beneficial. We commence with a factor often overlooked, yet one that bears a direct impact: body weight. Many are unaware that the penis is anchored internally within the pelvis, and the more substantial the fat layer in the infra-abdominal region, the more buried it appears. This isn't a matter of physical shrinkage, but rather of concealment. Samira recounts observing patients whose significant accumulation of pubic fat made them appear to have up to 4 centimeters less in visible length. Furthermore, when a man embarks on a weight loss regimen, especially one targeting abdominal fat, the benefits become apparent not merely in their physical appearance, but also in their self-esteem and sexual well-being. This phenomenon, colloquially known as buried penis, primarily affects men who are overweight or exhibit central obesity, characterized by a more prominent abdomen. Intriguingly, even in individuals with an apparently reasonable body weight, localized adipose accumulation in this region can already create the false perception of penile diminution. The encouraging news? It is in fact reversible. Through a suitable nutritional regimen and consistent physical activity, numerous men report discernible and enduring transformations. However, it is crucial to recognize that this constitutes a gradual process, not a simple on-off switch. Continuing within this paradigm of revealing what is already inherent, a seldom discussed yet profoundly visually impactful practice is the grooming of the genital area. Superfluous pilosity at the penile base casts a visual shadow that perceptibly foreshortens the field of vision. The removal or reduction of this hair thereby unveils more of the penile structure, consequently augmenting the perceived dimension. Samira advises that the optimal approach involves utilizing electric trimmers or small scissors, eschewing conventional razors and potent depilatory creams that risk dermal irritation and induce discomfort. Now, before we proceed to the subsequent sections, tell me one thing in the comments below. Were you already familiar with any of these strategies? Or even better, have you put any into practice and observed a difference? Share your experience or questions here, because beyond just building a channel, we are cultivating a community of men who aspire to understand themselves more deeply, prioritize their well-being, and uphold self-respect throughout all stages of life. In capitalizing on this moment, should this content prove beneficial to you in any way, I urge you to subscribe to the channel here. Truly. This straightforward action profoundly assists in disseminating this caliber of quality information to a broader audience who, perhaps much like yourself, may only require a catalyst to reconnect with their intrinsic power. Our discourse here is transparent, direct, and meticulously crafted with your needs in mind. We warmly invite you to join our community. Now we're going to delve into a little-known realm: intimate physical therapy. Indeed, physical therapy isn't solely for the spine, knees, or shoulders. A specialized domain exists that addresses the musculature of the pelvic floor, the very muscles that support the genital organs and are crucial for maintaining robust erectile and vascular function. The penis, akin to any other corporeal structure, relies upon robust blood circulation, neural stimulation, and muscular tonus. If one experiences extended periods devoid of sexual stimulation, whether owing to inhibition, stress, or shame. This region tends to decondition. And yes, it can indeed suffer a diminution in tone, volume, and rigidity. Samira explains that men aged 38 to 52 are the most frequent seekers of this type of treatment, typically after experiencing changes in their sexual life, such as difficulty maintaining an erection, diminished sensitivity, or even penile shortening. The encouraging news is that, through specific exercises guided by qualified professionals, it's possible to regain some of these functions and prevent the condition from deteriorating further. One employed technique is vacuum therapy, a negative pressure cylinder that stimulates penile blood circulation, thereby enhancing volume and tissue oxygenation. When judiciously guided, this practice proves to be both safe and remarkably efficacious. It does not supersede sexual intercourse or masturbation. Rather, it functions as a form of physical conditioning for the penis. You'd train your biceps for growth, wouldn't you? The underlying principle is analogous concerning your sexual organ: application, stimulation, and recuperation. Yet another aspect that can directly influence the appearance and health of the penis is excessive foreskin. Many men live with mild phimosis or even complete glans coverage throughout their lives. This not only impacts hygiene and sensitivity, but also diminishes the full exposure of the glans, which visually creates an impression of shortening. The surgical removal of this skin, known as postectomy, is a straightforward outpatient procedure that can lead to significant improvements in both aesthetics and functionality. Samira notes that many of her patients report feeling more confident and even a greater sense of ownership over their own bodies after undergoing the procedure. It's not merely an aesthetic concern, it is functional, psychological, and even liberating. We now delve into one of the most contentious, yet extensively researched practices: penile traction devices. The underlying premise is deceptively simple, yet it rigorously demands unwavering discipline to incrementally extend the penis through sustained, moderate mechanical traction over an extended period. Optimal efficacy typically necessitates a daily application ranging from 4 to 6 hours, sustained for a minimum of 5 consecutive months. Empirical studies consistently demonstrate that this methodology can yield increases of up to 2.5 centimeters in flaccid penile length and up to 1.5 centimeters in erect length. It is paramount to bear in mind that this must be performed using professional-grade equipment under expert supervision. Makeshift approaches, improper application, and undue force may result in irreparable harm. Samira is unequivocal. The guidance must be a collaborative effort between a physician and a pelvic physical therapist. Under no circumstances should one purchase an extender online and proceed to use it without professional oversight. Ultimately, it's crucial to emphasize that none of these practices in isolation will perform miracles. However, when synergistically combined, including weight loss, strategic hair removal, intimate physical therapy, foreskin care, and the judicious use of devices, they can yield transformations that are not merely visual, but profoundly emotional. Most importantly, respect your body, comprehend its boundaries, and prioritize health over aesthetics. True self-esteem stems from consistent self-care, not from comparison. And now, I'd like to extend a particular invitation to you. If this content resonated with you, if it somehow moved you, or awakened a novel perspective on your own physicality, I encourage you to subscribe to this channel. Yet, more than merely subscribing, we invite you to share your narrative with us. How has your relationship with your body unfolded? What challenges have you encountered? And what insights have propelled your personal evolution? The comment section is open, inviting us to collectively cultivate a space of acceptance, empathetic listening, and reciprocal growth. Let's forge this community together. And if you found value in this video, please share your key takeaways today. Your input is invaluable in enabling us to consistently deliver authentic, beneficial, and uninhibited content. Warmly, and until our next video.